I think we'll go ahead and bring up our next speaker, which is Dr. Rob Van Wessem. Dr. Van Wessem is the owner and operator of Equine All Sports Medicine Center in Mason, Michigan, and his research interests include musculoskeletal ultrasonography and sports medicine. Today, he's going to present how to use power Doppler and musculoskeletal ultrasonography in the horse.
Thanks for the introduction. I'm very happy that I can show you some newer techniques that are not very common yet in equine medicine or ultrasonography, and it's the use of power Doppler. I'll go a little bit more into detail what it is, how you use it, and then show you some fun pictures what you can do with it. This is the mandatory statements here. Relevance to clinical practice. I'll tell you how I got to use power Doppler 15 years ago. I had a rheumatologist, human rheumatologist in our practice that discussed with me results of diagnostic procedures on his horse, and he told me that in people, quite often rheumatoid arthritis gives a lot of arthritis pain in different joints, and it's very difficult for the patient to point which joint really is the problem. And when you look at imaging, then they all show problems. So they have a problem like which joint to really treat. And they used power Doppler to look at synovial blood flow pattern as an indication for having an active joint being more painful. And there's quite some literature out there in the human field. It's very accurate in pinpointing at that. And our cases are similar. They cannot really tell you which joint hurts the most. Quite often we have more pathology in different imaging modalities, and it makes it difficult for us to make a decision which one of them is really important. And I think power Doppler can really help you. It's easily additional information that you cannot really get quickly otherwise, and it's really easy to do. And what's good for here us today, and maybe not so much for all the exhibitors outside, is that quite often the option is already on your ultrasound machine, so you don't have to run out and buy a new machine. It's there. Power Doppler is more or less similar like Doppler. You use frequency to get an image from blood flow. The difference is in power Doppler, it's independent of the direction of the blood flow. So a lot of the calculating power of your machine is used to just see how much flow is there and not where it's going. It uses a different color in most machines, quite often yellow to orange to quite red instead of the red and blue. But it's much more sensitive, and that is very helpful in getting more information. Yeah, that's what I just said. It's very easy, a very sensitive tool to look at very small blood vessel activity in and around joints, tendons, and ligaments. It has a higher sensitivity, 2 or 3 times higher than standard color Doppler. We have only one thing here, and what you can see here is we can flash artifacts. As soon as you have a little bit of motion in the horse, we get really, everything gets one color, far more than with the standard Doppler, just because it's more sensitive. What can we use it for? Well, in general, in human medicine, it's used a lot for organs and tumors. I'm very interested in musculoskeletal, so I used it for that. And I have to say, it's quite easy to use. Let's go a little bit about technique, how you do it. What I always do is a 2-part sequence. I first use my standard ultrasound techniques to just image the structure that, to me, is important to look at. And then I go with power Doppler. The reason for that is that when you use power Doppler, again, a little bit of your CPU capacity of your machine is used for imaging the blood flow, and you might lose some details on your normal grayscale. So first grayscale, and then exactly same settings in both passes for depth and for frequency. And later, when you find something, you can always change that and make it more in-depth. But in general, I always go over the same structure twice, first with normal grayscale, and then with my power Doppler. And we always like with more or less any ultrasound imaging, 2-directional imaging, sagittal, transverse, things like that. Technique for the preparation is similar: clipping, cleaning, gel and or alcohol, depending on which structure you're looking at. If you use near field or far field. I use sedation a lot, especially with power Doppler, because motion quickly gives you your flash effect. So if the horse is really standing quiet, it's much easier. Also, when I do multiple passes, I want to make my passes nearly identical. If the horse just moved and did different things, it becomes very difficult to have the same imaging for both passes. So I try to have them not move too much. I find out that sitting for images of the lower limb is really helpful to be more steady and not move. and what I can use when I do more structures on the axial skeleton, I can use a pillow underneath my arm to have good contact with the horse, and when he moves a little bit, tiny little bit, I don't directly have my flash effect. We look for gain settings for a power Doppler image from maximum 50%. If you go higher, you get a very colorful image that really doesn't help you. It can help when you start to add changes to your initial setting to change your pulse repetition frequency or using a smaller field of view to really look into a certain structure. But initially, I started exactly the same settings as I did for my grayscale pass. Good to realize is when you push too hard on your transducer, you will quite often have smaller vessels collapse, so you don't see anything. So be aware of that. And sometimes for ultrasound, for tendon structures, we have to push quite hard. That might make it difficult, and in your second pass, I might change the amount of pressure on my image. Showing again, it's important that for my good initial grayscale imaging, I can push hard, and then for my second pass, I can change that a little bit to facilitate better power Doppler imaging. It's also different if a horse is weight bearing or not. Good to realize that. Quite often, when they stand, some of the vessels are more closed than they will be in non-weight bearing. And so when you're imaging them, be aware of that you can see differences. We don't really know how a lot of vasoconstrictives and sedatives work on the effects you can see with power Doppler. So we have to realize that maybe we can see differences there too. For me, it's as always very nice then at least to do the same thing like we do with normal imaging, do split screen imaging and image the contralateral check structure, leg structure with grayscale imaging as well as power Doppler. What you also could see is that after exercise, the vascular activity of a certain structure may increase. That also makes it important that when you do over time more evaluations, that you always do them at the same time. If you look at a certain structure to see the effect of treatment or rehab, and the first time it was before work and then the second time it's after work, you can get really different values or different images you see, and so use that to your advantage and use it. The same thing we have, I live in Michigan, we have very hot summers and very cold winters. We are happy that we have a climate-controlled exam room because you would see an effect of decreased vascular activity in the cold leg. And so it's nice that that doesn't change a lot if I see the horse first in summer and then I see it in winter, and I get completely different images. Sometimes it could help to have a horse exercise and see more significant changes between the left and right leg or contralateral limb after some work. So that can help you to, for sure you have to be a little bit more proficient already in power Doppler to do those things, but it could be really interesting to see if you before exercise and after exercise look at the same limb again with power Doppler, you might see more difference that you can appreciate after exercise than before. We don't really know the effect of laser, pulsed electromagnetic field, theraplate and things like that on the effect on blood vessels. So again, be aware of that. If you once have the horse just treated with laser or it had been on the theraplate, you might get a different outcome than when the same horse was not receiving those kind of treatments. What's really important, if you do sequential imaging, every time you see the horse again, you do that, and I do that a lot, especially to get an idea of my rehab effect. Don't change things. You would like to have a couple of standard settings on your machine, also for power Doppler, that you always start with, and you can go back to that every horse starts with more or less the same settings, and every exam over time starts with the same settings. If you don't have a standard set, it's very difficult to have comparable images over time. What's really important is that power Doppler is just an addition. It's never my own tool or my sole tool. I will always do the standard exam like what everybody talks about. I always have my normal imaging techniques, ultrasound, X-ray, and I just add it on to give me some more information. Two examples from lectures today where I was thinking I would do power Doppler is for instance, the patellar ligament, where you get all those changes in structure that we have seen presented today. It's very helpful with power Doppler, look at both structures and see if they have the same blood flow or not. If one of them has much more, you have more an indication there's still something going on there. Same thing with cervical or facet joints. I use power Doppler a lot to get some more additional information on, like in a fused joint. Is that normal? Is it not normal? Do I see more blood flow activity around it, around the joint, as an indication for having a problem there? What you will see is that if you do it once or twice, it becomes really difficult to do the same technique later back again and get a similar image. When I had my talk with my human client, a rheumatologist, I started adding it on nearly every imaging. It's not a lot, it's a couple of minutes extra. It gets me really good at making similar images over time, and you get a lot of extra data that you can store. I also have to say, quite often, clients, if they're present with an exam, are quite impressed with just a 5-minute extra second pass, and they see all the colors and you explain what that to them is. I would say if you're interested in using power Doppler, don't do it just once, because then you got a bit lost in what you're seeing. If you think it's a good tool for you, start to do it a lot, practice, practice, practice. It's only 5 minutes more, maybe not even on a standard exam, and it gives you so much more information later. What can we do musculoskeletal? What kind of answers does power Doppler gives us? Well, what we for sure can do is we can differentiate between an active and an inactive tendon or ligament lesion. You've seen quite often on ultrasound it's not that easy. Structures sometimes can throw you off. You see things that make it look like it's quite old and it's not, or the opposite. Degeneration is not that easy sometimes to just by ultrasound get an ID, and power Doppler really gives you a good indication more in that direction where you're looking at. Tendinitis and tendinosis, tendinitis being the active inflammation of a tendon, and tendinosis more or less like the degeneration. They're very well to distinguish with power Doppler. And a differentiation between an active and a non-active synovitis. I'll show you a nice example of a tendon sheet. We all know them, wind puffs, and then the client is really worried if that's an active problem or not. And ultrasound will tell you something. Power Doppler gives you again extra information on how active that process is there. What we in general see when we do rehabilitation evaluation, and again in tendon and ligaments injuries, I guess a lot of us will do that and see that horse over time, every time again, to guide the rehab status and improve the amount of work. It's very good tool to use your power Doppler and see that with healing, quite often we get less and less and less vascular activity around that structure that we're observing. And when you see a sudden increase in vascular activity during rehab, when you don't even see all the problems yet, you have a good indication that maybe your rehab is going a little bit too fast, and you can adapt that program before they really get another re-injury of a tendon or ligament. So it helps really, me at least in my practice a lot, in making decisions for where my next step is. In general, I work with protocols. I see those horses back every 2 months, but you have a status quo at that moment to see, like, can we proceed to the next phase, or do we have to make some little adaptations? My power Doppler is a great tool to see if my amount of inflammation, if you might simplify that, if my amount of inflammation is going down when my power Doppler activity is going down. It is quite helpful to know your anatomy of that region where you're looking at quite well, because if there's blood flow in a standing or in an existing vascular structure there, or it is flowing out into your tendon, what sometimes in an ultrasound is really not so easy to appreciate difference, they have a huge difference in impact. If you have just a blood vessel having some more activity close to your structure, that might just even be coincidence. When you see a little bit of the blood flow dissipate into your structure, you know you really have a problem in that structure. And so knowing anatomy, even more than normal, especially vascular anatomy, is very helpful. You see that again, that knowing your structures, knowing your joint structures, where is the blood vessels located in your synovial membrane or close to the synovial membrane in your joint, where close to, that helps a lot. So sometimes it's very interesting to go back to books, anatomy, and look at that part that before I started doing Doppler was not that common to me. I was more interested in the musculoskeletal structures than really the vascular structures. Let's make it more interesting before you all fall asleep. Let's get some pictures there. And I'll start with a little video. I don't really do a lot of the imaging. I for sure not save them in Loop because there's so much data, but especially when you have the client there, they love seeing this. This is an image where we just have the standard normal blood flow in a vessel in the lower limb of a horse. And what we could see here is one that had showing that effect where your blood flow flashes out in the tissue around it and not just stays in the vessel. So a big difference in what you could see. And if you would look at that with a standard normal Doppler, you would not really see that pattern. It's so much more sensitive to show you that. Here a good image of a lesion in the attachment of the suspensory ligament to sesame bone. But we can clearly see there is some structural problems, but it might not be clear if that's acute or not. And then you see the power Doppler image next to it, which shows you there's quite a lot of really active blood flow into that structure, telling you it's very active. This was a horse that the owner told me like it had problems before, and it was swollen in that region, so you start to think based on the story that this is a more older injury. My power Doppler started to make me think it's maybe more recent or it's more an activation of an older injury. Similar longitudinal views of the insertion or close to the insertion of the suspensory ligament. Always again, image left and right, same settings, and then you can see we have some blood vessel activity close to the bone. And when you look more in depth, we have, like what we saw in one of the presentations earlier today before, has some bony changes in that same region. So it points you exactly at something else that you might see with other modalities too already, and it points you again in that same direction, like, yeah, we still have something there, because my power Doppler confirms what I see on my other diagnostic imaging modalities. Here I have an image what is a little bit more worrisome. If you get like a very diffuse pattern of flow that's not really related to a blood vessel close by, that's very often an indication for real degeneration of a tendon or ligament. And so that, again, structure-wise, you might already get that idea. Your power Doppler might really help you to make a decision in that direction. Here we see a tendon sheet with some effusion in it, some reaction of the synovial membrane. Not clear if that's old and not relative or not. When we look at power Doppler, you can see that there's quite a lot of blood flow just close to your synovial structures, a clear indication that that process is maybe much more active than you would think based on ultrasound. Another example here, a tendon sheet, sesame tendon sheet, with quite some reaction from the synovial membrane here. What might you think this is maybe quite active, and then you see our activity. There is clearly some blood activity compared to the image to the other side there, but it's not really going close to this direction where I would expected it when we really would have an active synovitis. And so this helps you to make a decision like, well, my ultrasound, my standard grayscale ultrasound image would say me like, wow, this is quite reactive, and my power Doppler makes me think it's maybe much more older already and quite consolidated there. I mentioned I can use it for looking at facet joints. We've seen that quite often our X-ray is not really helpful in telling which of those joints is really the problem. Ultrasound might help. I think that then using ultrasound, power Doppler is a good tool too. We did a preliminary little study to see and compare the results of bone scan in that region and showed activity in facet joints compared to power Doppler. That was quite a good correlation, but the problem is still that we're then not looking at arthritis or synovitis, or maybe the difference. So that's a project that is still under investigation, and I hope to publish on that maybe next year. My take-home message for today is that it's really easy to add this little technique on to your standard imaging technique. And if you do it a couple of times in sequence, it gives you really a lot of extra information with what's really important, no extra cost. I don't know if you want to charge the client for it, but to me, this is a standard package they get. And when they see me doing this and they go to another specialist and they don't see the color, they don't see that, they look at that aspect of it, their perception is that I'm more complete maybe in my exam, so it helps me to sell my practice, let's say that in that way. And by performing PD sequences at each musculoskeletal ultrasound exam, we get so much more information you otherwise would miss. So I would really say, look into it. If you have it on your machine, look if you're accurate with using it. It's a very good tool. I'm very happy with it. As a member of the PR committee at ACMSR, I wanted to give you a little heads up that we get our first ACMSR symposium next year, and they have a very, very good equine program with a lot of imaging and sport medicine. So if you're interested in that, please look us up, and you might learn a little bit more about musculoskeletal imaging. Thank you.